Quick disclaimer, information in this podcast is for general informational purposes only and is not intended to be treated as medical advice. Always consult with your healthcare team before making changes to your diet, lifestyle, supplementation, or medication.
I love hearing from you because your questions are the ones so many other people are thinking about but maybe haven't asked yet or maybe need to be heard again. So thanks to Linda, Liana, Carol, Benjamin, Glancina, Margaret, Judith and Carol for sending in today's questions.
Welcome to Type 2 Diabetes Talk, the place where we chat about what really works to treat type 2 diabetes and prediabetes naturally with nutrition and lifestyle. If you're looking to optimize blood sugar and A1c, lose weight, reduce medications, and improve your overall health, this is the place to be. Now, here's your host, Type 2 Diabetes Nutrition Specialist, Dr. Jedha.
Hello, wonderful people. Welcome back to another Q&A episode. These are some of my favourite episodes to do because they're driven by your real-life experiences and challenges. Today, we're covering some really practical topics, from why your meter readings might be all over the place to how illness can affect A1c, why fasting blood sugar can vary even on the same meals, and how to bring your numbers down even if exercise isn't possible. Whether you've just been diagnosed, you've been managing your blood sugar for years, or you're somewhere in between, there's always more to learn, and the answers we cover today might just give you the clarity or confidence you've been looking for. If you have a question yourself, please head to type2diabetestalk.com/message and send it in. Don't be shy because the only stupid question is the one you don't ask. So let's get started today with Linda's question. Linda is one of our VIP members and asked, on numerous occasions I have tested my blood with multiple finger sticks on different fingers and always get different readings. For example, today I tested before lunch. In order, these were the results: 128, 101, 128, 152. This can't be correct, she adds with an exclamation mark. I'm going to order a new meter, but can you shed some light on this? Also address squeezing the finger to get a drop of blood. At 73, my fingertips are not plump. My husband said I can't squeeze, but the needle just bounces and doesn't penetrate. Linda, this is such a great question, so thanks for asking it because I know a lot of people have had the same experience and wondered if their meter is broken. The first thing to know is that glucose meters aren't perfect. By design, they're allowed to have some variation. The international standard for meter accuracy means your reading can be within about plus or minus 15% of your actual blood sugar level and still be considered accurate. So if your true reading was, say, 128 milligrams per decilitre, which is 7.1 millimoles per litre, your meter could legally read anywhere from about 109 to 147, which is 6.1 to 8.2, and still be right according to those guidelines. Now, I know that sounds ridiculous because there's a potential 38-point difference in those values, or 2.1 for our metric listeners, which is quite a lot. When you test multiple times in a row on different fingers, you're introducing a few extra variables. Blood sugar isn't evenly mixed throughout the body like stirring sugar into a cup of tea. It's constantly moving in and out of the bloodstream. So even a few seconds between finger sticks, slight differences in blood flow to different fingers, or how you place the strip in the drop of blood can all cause small changes. Plus things like temperature, how hydrated you are, and whether your hands are warm or cold. This can influence readings. So yes, there are several variables that can come into play. On your readings before lunch, Linda, a variation of 101 to 152 in back-to-back tests is wider than we'd expect from meter accuracy alone, but it's not unusual to see differences of 10 to 20 points. If you're consistently getting very different numbers, it's certainly worth considering whether your meter needs recalibrating or is faulty and you do need a new one. But it's also important to realise that no home-based value is 100% accurate. That's why it's important to monitor patterns and trends over time, because these are far more important than any single reading. And then you can get confirmation from those regular lab tests that your doctor orders. On the squeezing issue, yes, you can get a false reading if you squeeze too hard, because that can dilute the drop of blood with fluid from the surrounding tissue. But if your fingertips aren't plump, a gentle squeeze or milking motion from further back on the finger is fine. But you can also try warming up your hands under warm water for 20 to 30 seconds, letting your arms hang by your side for a minute, or shaking your hands a bit before testing, because that can help to increase the blood flow. But if you feel like the lancet is just bouncing off, you might need to change it to a slightly deeper setting on the lancing device, or try using the sides of your fingertips instead of the pads, because the skin there is usually a bit thinner. So I hope that gives you some enlightenment, Linda, and a few tips on getting better results. But just remember that tracking those patterns is more important than any single number. Next up, Liana asked a couple of interesting questions. Firstly, she said, is it possible for A1c to be affected since sickness increases glucose levels? My A1c was elevated, but I had been quite sick the month prior to the blood draw. My white blood count and neutrophils were up as well. And are there any other medical events that can spike glucose in the body other than stress, diet, lack of sleep, the usuals? Liana, this is a really important question because it does highlight how many different factors can influence an A1c result. And sometimes those factors have nothing to do with your everyday food or lifestyle choices. Yes, recent illness can absolutely affect your A1c. When you're sick, especially with an infection, your body releases stress hormones like cortisol and adrenaline. These hormones trigger the liver to release more glucose into the bloodstream to give your body extra energy to fight the illness. This can cause your blood sugar levels to run higher than normal for several days or even weeks, depending on how severe or prolonged the illness is. Since your A1c reflects your average blood sugar over the past 2 to 3 months, a week or two of higher readings can raise that average, particularly if it happens close to your blood draw. Other medical events can cause a similar effect. Surgery, injuries, burns, or an acute inflammatory condition, these things can all trigger the same stress response and push glucose levels up. Certain medications, such as corticosteroids, are well known for spiking blood sugar. Hormonal changes, such as those during menopause or thyroid disorders, can also play a role. And while you already mentioned stress, diet, and lack of sleep, it's worth noting that chronic pain, underlying infections you may not be aware of, and even dental infections can all increase glucose levels. So there are lots of different variables that can have an impact on those A1c results. Liana also asked, is there any correlation between subclinical or clinical hypothyroidism and higher A1c levels? If hypothyroidism is treated with medication, does that favourably affect glucose levels in the body? Well, Liana, there certainly is a correlation between both subclinical and clinical hypothyroidism and higher blood sugar levels, including higher A1c. Thyroid hormones play a role in how your body uses glucose and responds to insulin. So when those hormones are low, as in hypothyroidism, low thyroid, you can become more insulin resistant. This means glucose tends to stay in the blood longer, which can raise your average blood sugar and therefore your A1c over time. Subclinical hypothyroidism has been linked in some studies to slightly higher fasting glucose and insulin levels compared to people with normal thyroid function. So the effect is more pronounced in clinical hypothyroidism, where thyroid hormones are clearly low. If hypothyroidism is treated effectively, with those thyroid medications and your thyroid levels return to the optimal range, it can improve insulin sensitivity and help normalise glucose metabolism. That doesn't mean the change will always be dramatic. Your overall blood sugar control still depends on other factors like carbohydrate intake, overall nutrition quality, physical activity, body weight, among other things. But correcting the thyroid imbalance can certainly remove one barrier to better control glucose levels. The main point is that if you have hypothyroidism, making sure it is well treated is an important part of supporting healthy blood sugar and A1c levels.
Don't spend months or years trying to work out how to treat your diabetes. With Dr. Jedha's VIP online membership, you'll have trusted support wherever you are at your fingertips whenever you need it. Access detailed guides to understand exactly what to eat. Explore the huge members library. Receive delicious weekly meal plans and join monthly member check-ins for personal feedback and accountability. Learn more and join as a VIP member today. Visit type2diabetestalk.com/programs.
Carol asked, can you provide suggestions for living with a spouse who can eat anything but hates veggies? Carol, I hear this a lot and you're definitely not alone. Many members have said the same thing and later their husbands ended up loving vegetables in the meals we've provided. Often it is a simple matter of how they're prepared. If someone's only ever had vegetables boiled until they're mushy or served plain, it's no surprise they don't like them. Vegetables change completely when you roast them in the oven with olive oil and seasoning, saute them with garlic and herbs, grill them until slightly charred, or blend them into soups and sauces so the flavour is rich and layered. Sometimes it's also about cutting them into smaller pieces, mixing them into familiar dishes to help get them started, or adding lots of cheese, some nuts or a good dressing to bring out the taste and flavour. Another approach is to focus on the ones that are naturally sweeter, like carrots, bell peppers, pumpkin or roasted cherry tomatoes, and gradually introduce new ones from there. You can also experiment with textures. Raw, crisp vegetables in salad or slaws can feel completely different to cooked ones, of course. And really, there's no rule that says you both have to eat the exact same plate of food. You can prepare your protein the same way, then add your own vegetables and let your husband have a different side if he truly can't get on board with eating more veggies. But look, as I said, I have seen this a lot, and I think that it is a matter of preparation and serving up those different meals and ideas, which we have lots of them in our members site that many husbands learn to adore and actually love. I mean, lots of our members say, my meat and potatoes husband even loves your meals. So keep on trying, and over time, curiosity and exposure often win people over. But in the meantime, you can still enjoy your vegetables without it becoming a battle. Benjamin asked, on a daily basis or per meal, how many milligrams of cholesterol should you consume? This is a great question, Benjamin, because there's still a lot of confusion about dietary cholesterol. For many years, dietary guidelines recommended limiting cholesterol to no more than 300 milligrams per day. That's one of the reasons why so many people didn't eat egg yolks, because one egg contains around 280 milligrams of cholesterol. The thing is, more recent research has shown that for most people, the cholesterol you eat has minimal effect on the cholesterol levels in your blood. So if you eat egg yolks, that cholesterol will have very little, if any, impact on your cholesterol levels. The body, especially the liver, controls cholesterol production. And usually it's our overall diet and other factors like insulin resistance or high blood sugar that's contributing to high cholesterol levels. But given this fact, that's why the US dietary guidelines removed the strict 300 milligram limit in 2015. So you don't have to worry about the milligrams of cholesterol you consume. That's not an important factor anymore. It's removed from the dietary guidelines. It's more important to consider your intake of processed foods and refined foods, sugar, and total carbohydrate intake, and the type and quality of fats and overall foods that you're eating. So I'd recommend listening to episodes 42 and 44 for more on understanding cholesterol and nutrition tips to combat high levels if that's a concern for you. Glycina asked, please help me. If the glucose level is between 8 and 9 millimoles per litre, what will be the A1c? My sister's range is that, and I would like to help her keep it lower with your diet. Thank you. Glycina. So a level between 8 and 9 millimoles per litre is 144 to 162 milligrams per decilitre. Now, just to point out, you can get a rough idea of an A1c from an average glucose, but it is important to remember it's only an estimate. So with those levels, that would roughly correspond to an A1c between 6.5 and 7.2%. Now, this isn't too bad, but if she would want to get better results, she'd be better off to aim for getting those numbers a bit lower. And what we want to see is those numbers under 7.8 millimoles or 140 2 hours after meals, because that will really help her achieve a normal A1c level, which ultimately is the ideal goal. I will leave a chart on those average glucose A1c corresponding levels in the episode notes if you want to go and have a look at those. Margaret asked, I'm in the UK. My doctor said my blood sugar is 42. I don't really understand this. Can you help, please? Margaret, in the UK and some other places, when your doctor says your blood sugar is 42, they're usually talking about your HbA1c result, which is measured in millimoles per mole. And HbA1c is a measure of your average blood glucose over a period of about 2 to 3 months. And if you have a HbA1c of 42 millimoles per mole, that's equivalent to about 6% in the percentage format that is used in most other countries. In the UK, this result indicates you have pre-diabetes. A HbA1c level of 42 to 47 millimoles per mole or 6.0 to 6.4% indicates pre-diabetes in the UK. This is different to the US, where a level of 5.7 or above indicates pre-diabetes. That's 39 in millimoles per mole. So that's what your number means. It means you have pre-diabetes and your doctor should have told you this. If they didn't, that's not great, but unfortunately it does happen as some doctors don't consider it an issue until you have type 2 diabetes. But it certainly is important. It's time for you to get proactive with your nutrition and lifestyle plan so you can reverse those numbers back to normal. The key, though, is to start now because the earlier you take action, the easier it is to turn things around. So you can use our podcast as a resource to get started with that, or head down to our website and consider joining one of our programs or becoming a member where we can support you to turn things around. On that note, let's hear a testimonial from one of our members.
Carmen said, I do not have to think about what to prepare for my meals. The recipes at hand make it so easy for me and my sister who loves the recipes. We are in and out of the kitchen so fast. My health has improved a great deal too. I used to have difficulties walking in the mornings due to joints inflammation. I have lost 20 pounds and I am inflammation and pain-free in the mornings. My blood sugars have come down to 105 in the mornings and A1c has come down from 6.5 to 5. I have recommended the site to many friends and colleagues. They are amazed at the fact that I have lost the weight without complaining about being hungry and tired of dieting. These meals have become my new way of life.
Our next question is from Judith, who said, I've been on a pre-diabetic eating plan for almost 3 months, pretty religiously. My fasting blood sugars are random, with some below 100, some in the high 80s, some are low to high 90s, and others above 100, usually between 100 and 106. A few times they've been around 112. I can eat the exact same meals in a day and have different fasting numbers, and I don't understand why. Any suggestions would be helpful. Judith, this is such a common question, and we have covered it quite a number of times on the podcast, but it's always an important topic to recap because it does come up time and time again. So here's the thing, even if you eat the exact same meals, your fasting blood sugar can vary from day to day because it's influenced by many factors other than food. One big factor is the dawn phenomenon, which is natural early morning rise in blood sugar triggered by our wake-me-up hormones, hormones like cortisol, adrenaline, and growth hormone. And these hormones tell your liver to release stored glucose to get you ready for the day. And the effect can be stronger on some days than others. Sleep quality, stress levels, illness, changes in activity, hormone fluctuations, and even how late you ate the night before can all shift your fasting numbers. And dehydration can also make readings look slightly higher. The numbers you are mentioning from the high 80s into the low 100s, with occasional readings around 112, well, these are mostly within range or just outside of the range, the 112 on a few occasions being the highest. For our metric listeners, that's between 4.4 to 5.6 and up to 6.2. So it's normal for blood sugar to fluctuate, and these levels aren't straying too far outside normal, which is great. The key is to watch the overall trend over weeks and months, not stress about every single morning number. And if your average fasting readings are coming down over time, and with fasting levels it can take a bit of time to rebalance, then you're moving in the right direction. You might like to listen to episode 38 to understand why blood sugar rises in the morning in more detail, and some tips to help you get those a bit lower as well. Our last question of the day comes from Carol. Carol said, I'm 74 years old, recently diagnosed pre-diabetic. A1c is 6.2. I have a heart condition, also a pacemaker and defibrillator. I have 14 herniated and degenerative discs in my back. I have difficulty standing for long periods of time. I'm on a lot of prescription medication. I think it would be very difficult for me to exercise. How can I lower my A1c? Carol, sorry to hear about that, because when you have multiple health conditions and physical limitations, understood, exercise can be challenging or sometimes even impossible. But lowering your A1c is still very achievable, even without any exercise at all. We've seen this happen in our members. And the key is diet and nutrition. Nutrition is the biggest driver of blood sugar control, so that's where you need to put your focus. And like I said, we've had many members who can't exercise at all and they still keep their blood sugar in the normal range without glucose-lowering medications, simply by focusing on the way they eat. So by doing that, you can still achieve normal A1c levels. And if you can, any form of movement can help, even gentle movement. Seated exercise would be a great option for you if you can't stand for very long. Or even short walks around the house, walking in place. These can all help with circulation and facilitate better blood glucose control. But they're not 100% essential for lowering blood sugar. Certainly exercise will help, and you can include any type, just small things. Overall, nutrition is going to be the most important thing for you to focus on. And if you need help with nutrition, you can get all the support you need by joining us as a member. You certainly don't have to spend hours on end surfing the Wild West Web for information that isn't going to help, because when you can get a clear path through being a member that will help you achieve normal numbers and plenty of support to do it. So please head on down to our website to learn more, because we'd love to support you to get better control of your numbers. Well, that's all the questions we have for today. As you can see, there are a lot of moving parts when it comes to blood sugar. It's not just about one meal or one number on your meter. The patterns you build with your nutrition, lifestyle, and awareness make all the difference over time. Small steps lead to big changes. I want to thank each of you who sent in questions because your curiosity helps everyone learn. If you need more support to put these strategies into action, remember you can find that inside our membership programs, and we'd love to welcome you as a member if you're not already one of our members. Until next time, keep focusing on what you can do today, because every step you take now will pay off in your future health. See you next week. Dr. Jedha, over and out.
Thanks for tuning in to Type 2 Diabetes Talk. Please subscribe to the show on your favorite podcast platform. And for episode replays, episode notes, and more, visit type2diabetestalk.com. New episodes are available Tuesdays, 10 a.m. US Eastern Time, or your time zone equivalent. Thanks again. We're truly grateful to be a part of your life and help make a real difference.